Namaste Bitya, Hamesha Khush Raho Bitya. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Associate Professor and HOD, Department of Practice of Medicine, in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jain. In this lecture, we are going to discuss about the abdominal examination. Whenever a patient is coming to us of abdominal pain or abdominal problem, or the problem related to the gastrointestinal system, then we have to do the abdominal examination. Examination of any system is based on two basic principles: general examination, that is known as general physical examination, and systemic examination. So in case of general examination, you are looking at the patient from head to toe, and in case of systemic examination, we are going to examine the patient in 4 steps, that is inspection, palpation, percussion and auscultation. So we are going to discuss in a very brief about this examination. So first of all, when a patient is coming to you, what are the various things that you are going to examine from the head to toe of a patient? So we have to, while looking at the patient from head to toe, it is known as general physical examination, where you are looking from head to toe. First of all, you are looking in the eyes of the patient, the face of the patient. We have to check for the facial expressions. Is the patient is in pain, agony, or any other discoloration? We have to look for the complexion of the patient. Then we have to look in the eyes. In the eyes, we have to look for jaundice and pallor. In the upper bulbar conjunctiva, we have to look for the jaundice, and in the lower palpebral conjunctiva, we have to check for the pallor. Then in the mouth, we have to check for any sort of ulceration, cracks in the mouth, or any offensive odor, or the condition of the gums and teeth. Then in the gums and teeth, we have to look for the any kind of cavitation or any bleeding from the gums. Then in the neck, we have to look for the jugular venous pressure. In the neck, we also have to check for the examination of the lymph nodes. I have discussed in a separate video the examination of the lymph nodes when a patient is coming to us. Then we have to check for the skin and bleeding surfaces. In the whole skin, we have to check for the any sort of bleeding that is occurring because of the abdominal problem. Then we have to look at the hands and feet of the patient. We have to check for the clubbing of the fingers. We have to check for koilonychia. We also have to look for any kind of flapping tremors that is seen in case of liver disease. Then we also have to check for the edema of the patient. We have to look for the pedal edema and also the sacral edema. So these are the various things that we have to look in general, that is known as general physical examination. Apart from these things, we have to look at the vitals like temperature, pulse and blood pressure. We also have to check for the oxygen saturation of the patient. These are the basic things that we need to examine in a patient who is coming to us. Then we have to go on the systemic examination. The systemic examination is completed in 4 steps. Inspection, when we are just looking at the patient and not doing anything else. Second is palpation, when we are touching the patient is known as palpation. Third is percussion, when we are percussing the patient and we are listening for different type of noises, sounds. And fourth is the auscultation. Any systemic examination is covered in these 4 steps: inspection, palpation, percussion and auscultation. So first of all, the inspection. In case of inspection, whenever a patient is coming to us, the inspection starts at that particular moment itself. In abdominal examination, we all know the abdomen is divided into 9 regions. 9 regions of the abdomen we have to first of all inspect. We have to check for the shape of the abdomen. We have to look at the position of the umbilicus. We have to see the contour of the abdomen. We have to look for any kind of dilated veins, any kind of dilated vessels, any kind of discoloration, scar marks. All these things we need to do the check in the inspection. We have to look for the shape of the abdomen. Normal abdomen is boat shaped or scaphoid shape. We have to look for the symmetry of the abdomen. We have to look at the position of the umbilicus, whether it is everted or inverted. And we also have to look at any kind of abdominal movement, scar marks, any mark of surgery, any discoloration, caput medusa. All these things we have to do in the inspection. Second is the palpation. Palpation we are doing in the 9 regions. Palpation is covered in 2 steps. First of all, we are doing light palpation, touching the abdomen 9 regions lightly, and then deep palpations is done. In the palpation, we are going to check for any kind of pain, any kind of guarding, rigidity, any kind of tenderness, rebound tenderness. Tenderness and rebound tenderness are seen when there is any inflammation in the viscera. Then we also have to check for the pulsations of the abdomen. We also have to palpate for any kind of fluid thrill or divarication of the recti. So these are the various things. Palpating, you have to palpate all the 9 regions superficially and then deep. the palpation of each and every organ, individual organ like liver, spleen and kidney. These are the three important organs that are palpated. I will be discussing the palpation of these three organs separately in a separate lecture. So this is palpation when we are palpating the 9 regions of the abdomen. Then the third comes the percussion. Percussion, we are percussing. This is the way of percussing, putting hand on the patient body and then percussing to listen for different type of sounds. There may be resonant sound, there may be dull sound, there may be stony dull sound. This helps to differentiate, to first of all identify the margins or the borders of any organ, and then to differentiate between the fluid and the air spaces. So in the percussion, we are looking for the percussion note that can be dull note, resonant note or stony dull note. Alright. By doing the percussion, we can also palpate the upper and the lower border of the liver. Also, splenic enlargement can be checked for in case of by doing the percussion, and the other enlargement of the other organs can also be done. The last thing is the auscultation. By doing the percussion, we can also check for the shifting dullness. If the patient is presenting with any sort of ascites or fluid filled in the cavity, then that is known as ascites, and for checking the ascites, percussion is the best method. We can look for the shifting dullness, we can look for the puddle sound, we can look for the fluid thrill, succussion splash. All these things require percussion. The last method is the auscultation. While auscultation, we are using the stethoscope. Using the stethoscope, we are listening for different type of sounds in the abdominal cavity. We are hearing for the bowel sounds, bruit and other kind of sounds, succussion sounds, the sounds that are present in the body using a stethoscope. So examination of the abdominal cavity or the abdomen is completed in 2 ways: general physical examination when we are looking at head to toe, and second is the systemic examination. In the general examination, we are looking for from the head to toe the facial expression, the mouth, the eyes, the mouth, the lymph node, the neck for the jugular venous pressure. We are also looking at mouth and gums, the skin, bleeding surface, and hands and feet for pedal edema. In the systemic examination, we are doing 4 steps: inspection, palpation, percussion, and auscultation. So this was all about the summary of the patient of the abdominal examination. I'll be demonstrating this thing on the patient itself. So this was all for today. We will be meeting with another important examination in the next lecture. So this was all for today. Thank you very much. Have a good day.